Well, today's program is emanating from Toronto, Canada. Toronto is kind of like the New York City of Canada. And the Toronto Star is the equivalent of the New York Times. In today's newspaper, big headlines, front section, routine medical tests may do more harm than good. Well, I've been saying that forever. Doctors kill more people every year from routine tests than the mafia does in 1,000 years, okay? At any rate, the headlines are, campaign urges MDs to think twice on 40 unnecessary procedures. Hello. And they don't give a number here in Canada, but usually Canadians, of course, they're 10% of we Americans. We're 300 million, they're 30 million. Their doctors want to be like our doctors, so they do all the stuff our doctors do. And I know for a fact, it was a big story, came out, released by the U.S. Department of Health and Human Services in 2010. 2010, it says not each, but U.S. doctors as a group, kill 15,000 seniors in the United States, people over age 65, each month. This is a monthly figure, okay? This is per month. This amounts to 170,000 a year by doing a screening test and things like minor medical procedures. Over the last couple of years, in America, in hospitals, some of the famous seniors doctors have killed are Andy Rooney from 60 Minutes, Dick Clark from he's the guy that found all the rock stars and so forth, very famous guy on TV. And then Neil Armstrong, our top astronaut. They killed Neil Armstrong by just doing some elective surgery on him that didn't need to be done. They killed Neil Armstrong. And then the big story, of course, here in Canada recently was Rita McNeil, who's kind of like the equivalent of Dolly Parton, very famous lady country western singer here in Canada. And they killed her in 3 days after doing some minor elective procedure, okay? And she died of a C. diff infection. Neil Armstrong died of complications of an elective cardiovascular procedure. Dick Clark died within a half hour after doing a prostate procedure. And then Andy Rooney died of infection because they punctured his intestine during a colonoscopic exam. Okay, these are just 4 famous people out of 15,000 they kill every month, seniors in hospitals doing screening tests and minor medical procedures. So the warning here is if your doctor wants to do some procedure on you, over age 65, say, no, I'm going to get a second, third, and fourth, and fifth opinion before I agree to that. And at the very least, you want to contact your longevity associate and ask for the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. And there's a chapter in Let's Play Doctor on home laboratories where you can do your own screening test. That's right. For about $1.50, you can do your own screening test. It's very, very simple. You can go to any pharmacy without a prescription and get test strips to dip in your urine sample to find out if you have blood or protein or sugar or an infection in your urine, pH, ketone bodies, all that kind of stuff. And then the book tells you how to read the numbers and what it means. And then for another $1.50, you can get another test strip to find out if you have diabetes or low blood sugar. You can find out in a 6-hour blood glucose test to see if you have reactive hypoglycemia or narcolepsy. And then, of course, you can do your own A1C hemoglobin to find out if you're doing a good job in managing your diabetes if you have one. And you can also do an occult blood test, which is the equivalent of a colonoscopic exam. It'll cost you less than $3. And it's very safe. You just wipe your bottom when you have a bowel movement, take some of the poop on the toilet paper and put it on the gel. And if it turns color, that means you have blood in there. Then you can go ask for specifically a non-invasive, high-resolution ultrasound to see if there's anything going on. It could be just external hemorrhoids or internal hemorrhoids that produce the blood, or eating a rare steak the night before. And then there's one that's a little more technical. It's called a FIT test, a fecal immunochemical test. And it's also looking for, more specifically, for colon and rectal cancer and so forth. You get those for about $5. Do all these things yourself. I like to do them with my family when we get together for Christmas and the 4th of July, when everybody's there. And, you get everybody's samples, you put their name on them, you have the test strips, and you do your whole family's physical for about, $5 a piece. How good is that? That's very, very good. Save everybody's life. Find out how their health is doing. You can do everybody's blood pressure. Give them a sheet of paper. You keep a copy for your files and start taking care of your own family. Take care of your own loved ones. You'll be amazed what you can do with this information from the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And don't forget the new books out. Immortality gives you the secrets to the top 20 longevity cultures, why they have 40 times 100-year-olds we do. And the newest one that just came out last month and last week of last month is called Epigenetics. The subtitle, I love the subtitle, is The Death of the Genetic Theory of Disease Transmission, because there's not a single disease that's caused by genetic transmission. It's all caused by nutritional deficiencies and how it affects our enzymes and our DNA and so forth. It'll be amazing to you. It'll be amazing. Even James Watson, one of the two guys that got the Nobel Prize in 1962 for proposing the double helix structure for DNA. In March of 2013, he said at the Salk Institute in California that all the genetic experiments that have been done have been irrelevant because everything is caused by biochemistry, nutritional deficiencies. Contact your Youngevity associate today and ask for the trilogy of books, ask for epigenetics, and ask for immortality. Add 25 to 50 healthy years to your life, and better yet, to the life of your family. We'll be back with more truth, justice, and the Youngevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about antioxidants today, as we have a story here from Fox News headlined, Dark Chocolate Ingredient May Prevent Obesity and Diabetes. And this comes from the Medical Daily. They say unprocessed dark chocolate may reduce a person's risk of obesity and diabetes, and it's due to the flavonols in the chocolate, which is, of course, a type of antioxidant shown to improve cardiovascular health and lower blood pressure, as well as improve blood flow. And they say the results were all published in the journal Agricultural and Food Chemistry. I noticed it wasn't the American Medical Association or JAMA or New England Journal of Medicine. They say these oligomeric procyanidins are seem to have the greatest protective health on effect, that is, on health. Mice were able to keep their weight. They did a study on mice where they gave them a high-fat diet rich in flavonols, and they said these mice were able to keep their weight down and their blood sugar low when consuming a diet rich in PCs, even when the overall content of their diet was high-fat. These oligomeric PCs processed the greatest anti-obesity and anti-diabetic bioactivities of the flavonols in cocoa, which are particularly in low doses employed for this present study. They say the flavonols are also what give the dark chocolate its bitter taste, so manufacturers often process cocoa to lessen that flavor, stripping it of its flavonols. So they say if you're going to try to use dark chocolate for this, you should get the unprocessed kind. So, and that actually, I think, kind of indicates you, Doc, because that's something you've been talking about for a number of years.
You're exactly right. Well done again, Doug. The Cocogevity is this type of dark chocolate. It has the flavonols in there to lower blood pressure and also great antioxidants. And as you point out, does reduce blood pressure, does reduce obesity risk and diabetes risk. And then we have the pieces of chocolate. Each piece is the size of a pat of butter. We have two different ones. Of course, the triple treat chocolate has the flavonols. It also has probiotics, and it also has ORAC points, antioxidant points, as measured. Each piece has like 17,000 ORAC points and some change. And so if you take 6 of those a day, you're getting over 100,000 ORAC points. And the long-lived peoples have 20,000 to 50,000 ORAC points. That's 100,000. So I try to match that. And they also have PEAs, phenylethylamines, which is the love chemical. Makes everybody all warm and fuzzy and lovey-dovey, so I like that. And then, of course, we have the triple truffle chocolate, which has the mushrooms in there to support your immune system, but also the triple truffle chocolate. Each piece has 1,000 international units of vitamin D3 and 500 milligrams of extra superabsorbable calcium. So 3 pieces of triple treat chocolate and 3 pieces of triple truffle chocolate together is a great, great supplement to lower blood pressure, to reduce your risk of obesity and diabetes, and also make you lovey-dovey. Yeah, the PAs are the love chemical, so we love the chocolate.
Yeah, you can't beat good chocolate. I like to buy, they say that if you are going to do chocolate for its antioxidant value, you should get at least, I think it's 60% of the cocoa percentage in that. Yeah, I remember when I was a kid, my mom used to use baker's chocolate to cook, and I didn't realize that it didn't have any sugar in it, so I was going to have myself a nice piece of chocolate, and she saw me getting into it and didn't bother to say anything and just sat there and watched my look on my face when I bit into it, and it was like sour as eating a piece of charcoal or something.
Well, the triple treats have blueberries in it to make it a little sweeter, but it doesn't affect negatively all of the antioxidants. So thank you. The oligomerics are great stuff. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Chico, California. And Mildred, you're on with Dr. Wallach.
Well, Mildred, you're on the air.
Hello, Dr. Wallach. I have a friend who has a lot of foot trouble. She has lost the padding on the ball of her feet, and she has a bunion. It's not too big yet, she said, but she had an appointment to have the bunion shaved. So I convinced her to hold off until we see what you had to, what recommendations you might have.
Okay, well, when you get a bunion, it's actually a result of osteoporosis / arthritis in that joint of the big toe and the metatarsals, part of the main part of the foot. And what happens is the ligaments and tendons that pull on that joint rotate that toe outward and cause a lot of inflammation, cause a lot of extra scar tissue and this, that, and the other. And so what I like to do, and how much does this lady weigh, you think?
Maybe 170.
Okay.
Around there.
Yeah, 170 pounds. So I'd give her 2 healthy bone and joint packs per month. That'll allow her to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and all that will be accomplished by the 2 healthy bone and joint packs per month. Now, she will also need to get one of those Dr. Scholl's bunion straps, and this thing is a Velcro thing. You can go into any drugstore or pharmacy without a prescription, get those things, and she should wear that at night. Cinch that toe up into the proper position at nighttime when she goes to bed after the shower or bath, and then take it off in the morning. Of course, I'd have her wear some nice soft shoes with some heavy sports socks and that kind of stuff, and then, of course, take her healthy bone and joint packs with her 15 glucogel a day, and she can use the CM cream directly on that joint, and of course there'll be 1 jar of CM cream with each of those 2 healthy bone and joint packs. It wouldn't hurt for her also to get the CM Plus capsules and have her take 3 or 4 of those 3 times a day orally, and that's going to relieve a lot of that inflammation from the inside, reduces the swelling, and makes that bunion more movable. Now, as far as losing the pad on the ball of her foot, did she lose some weight?
Not that I'm aware of.
Yeah, because oftentimes you'll lose that ball of fat under your foot when you lose weight, because you'll lose weight there too. But make sure she's eating plenty of calories from things like baked sweet potatoes, red meat, and eggs every day, and we'll get that foot pad back. Call me every 2 weeks. We'll be back after these messages.
Let's head to North Carolina. And Greg, you're on with Dr. Wallach.
Hello, Greg. You're on the air. Hello, Greg. You're on the air.
Yes. How you doing today?
Okay, sir. How can we help you?
All right. Got a question in regards to one of our customers who's dealing with high blood pressure and also diabetes. So they're using the healthy blood sugar pack and also added the Ultimate Dailies in with that. Was also having issues with the knee, so I added glucogel with that. Things have been running pretty steady for a while, and then all of a sudden the blood pressure just spiked up and heart rate went up. And so they went into the doctor, and doctor has prescribed them on a 3rd blood pressure medication, which the side effects of that is that it will cause your blood sugar to increase. So instead of finding something else, they added a blood sugar medication to the list of things that they were taking. So
sure.
Want to get your recommendation on what could have possibly caused it just to, for it to run stable for so long and then out of nowhere it kind of goes high. And they're on a gluten-free diet, by the way.
Mm-hmm. Sure. Well, it could be drinking one of those sports drinks or energy drinks. It could be, have guarana or caffeine in them. It could be something inflammatory, like eating some fried chicken, just breaking the rules once and eating some fried chicken, inflaming those arteries inside the kidneys. Kidneys release renin, spikes the blood pressure. It's something that this individual did. Say, well, I'm running pretty good here. It's not going to hurt for me to just cheat once. And they go to maybe just have some fried chicken. What can hurt with one piece of fried chicken after church? Bam, you're dead. And so when you're going good, you don't want to get off the rails. You don't want to cheat once. It's that critical. You have to be obsessive about this. And it's human nature. It's human nature to let down your guard when you're feeling good. And so I would suspect, if you really, question this individual, that there was a drumstick in there somewhere, or a BLT sandwich, or maybe one of these ham salad sandwiches or egg salad sandwiches with mayonnaise in it, or a salad with lots of olive oil in it, something like that. There was something inflammatory that irritated those little afferent arteries in the kidneys, caused them to swell shut, and the kidney release renin spikes up the blood pressure. So that would be my best guess here. But at any rate, got to get him back on the rails, and you got to realize, hey, he survived the experience. A lot of people don't survive the experience. Just one bad thing, it's a bad decision, and it kills him. So he's lucky, so he needs to get back on the rails, Greg. Good example. Thank you. We'll be back after these messages.
Let's head to New York. And Camillus, you're on with Dr. Wallach.
Camillus, you're on the air.
Yes, doctor. I am 67. I have high blood pressure. And also both of my knees, I had torn meniscus. So I have got them microscopic surgery, but still they pain. And also I'm at the borderline of diabetic, and I have a stent in my heart. I need your suggestion. What should I take?
I'm just getting all this written down. Okay, so you have a stent in the heart. Okay, so I'm assuming you had either chest pain or did you have chest pain or a heart attack?
No, I had shortness of breath once, and then I went to the doctor and they did the catheterization, and they told me that I need a stent. So they put 3 stents in my heart. I
got you. So you have heart stents, you have knee problems, you had arthroscopic surgery, high blood pressure, and prediabetes. How much do you weigh, sir?
205.
Okay. So what I would do, got to get rid of all the bad stuff that's caused this problem. No fried foods. I mean, absolutely drop dead, no fried foods, no exceptions. Absolutely no processed meats with nitrates and nitrites. It means no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, canned meats, hot dogs, all that's got to go. Absolutely no oils, no olive oil, no coconut oil, no margarines, mayonnaise, salad dressings, cooking oils. If you're going to eat canned fish, they're going to be packed in water, mustard, tomato sauce, not oils. And then no gluten, no wheat, barley, rye, and oats. No wheat, barley, rye, and oats. We're eliminating all the inflammatory foods that are going to cause inflammation in the blood vessels, okay? Which contribute to the high blood pressure and the stents in your heart and all that kind of stuff. Also make your knees worse, also make your diabetes worse by affecting the cell membranes of every cell in your body. So the dietary changes are imperative. You have to stop the ongoing damage. And at 205 pounds, I'd have you take 2 of the healthy heart and brain packs per month, 2 healthy heart and brain packs per month. That's 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Ante Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner. And all that will be accomplished by the 2 healthy heart and brain packs per month. Then for the stents and everything, I want you to put in 9 of the Ultimate Daily tablets a day. 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 2 bottles a month of the Ultimate Daily tablets, and they're designed to support and promote healthy blood flow through obstructed arteries in the brain, the eyes, the heart, and the kidneys. It'll also support and promote healthy blood pressure directly and indirectly. Now, because you also have prediabetes, I'd have you take 6 of the Sweeties a day, 3 at breakfast, 3 at dinner. That's 2 bottles a month of the Sweeties. And I'm assuming you're not on diabetic medication. If you are on diabetic medication, either pills or insulin, I do want you to test your fasting blood sugar in the morning before you medicate yourself, because your blood sugar will drop dramatically. All right. Then, because you do have the knee stuff, okay, you need 2 large bottles of glucogel, and that'll allow you to have 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and the 15 glucogel a day are designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes the bone itself. And when it comes to meniscus, I've even rebuilt meniscus completely, 100%, even when people have had them surgically removed after accidents. Okay, the doctors, the orthopedic surgeons have removed their meniscus, and several years later when they had another knee injury, they had an MRI done. The doctor says, well, at least your meniscus are okay. And the patient said, no, wait a minute, you removed them 5 years ago. And so we know that we can rebuild meniscus because we've done it many, many times. It's amazing, even when they're surgically removed. So this is a pretty good thing for you here because guess what? We have a lot of experience in all these areas. Give us a call every 2 weeks and give us a report, and we will walk you through this. Okay, Doug, let's go to callers.
Let's head to Maryland. And Pat, you're on with Dr. Wallach.
Hello, Pat, you're on the air.
Hi, Dr. Wallach. I started having swelling in my ankles, and this has been going on for about 6 days. I'm on the Cozar, 100 milligrams of Cozar, 200 milligrams of Dilacor for high blood pressure, and I'm taking 15 gel caps a day. So I don't know why they're swelling. I put it in Epsom salt water, and it took it down a little bit, but they just keep swelling.
Mm-hmm. Okay, how many eggs a day are you eating?
I might eat 1.
How much do you weigh?
215.
Okay, you need to be eating 10 eggs a day. You may have a low blood protein situation here. Low blood protein will result in edema in the legs and the ankles and the feet, particularly if you have inadvertently contacted salt. Now, salt does not cause high blood pressure, but because of osmotic gradients, if you have low blood protein and you use salt, you will get some edema. And so when people get edema that is unremitting, in other words, you can't get rid of it by normal means, even water pills sometimes, like Lasix, diuretics don't work very well in this situation. You have to get your egg consumption up, 8-10 a day for a lady your weight, and it wouldn't hurt for you to take some ASAP, add that to your program. I'm assuming, I didn't hear it, but I'm assuming you're taking in the 90 essential nutrients, not just the 15 glucogel capsules a day.
Yeah.
Yeah, okay, you'd need to be taking either an ounce twice a day of the Ultimate Classic or 2, in your case, I would have you take, because of the blood pressure and the weight, I'd have you taking 2 healthy 2 healthy heart and brain packs per month. But I would throw in the ASAP. ASAP. How tall are you?
5'8".
Okay, if you're 5'8", I'd be happy to see you something like maybe 170, 165, 170 for a lady. Okay, so I want to see you lose anywhere from 30 to 45, 50 pounds, and I would do that. Get you 1 bottle of the ASAP a month, so you can take a dropper full under your tongue 30 minutes before each meal, and usually within a day or two, you're going to start losing a half a pound to 2 pounds a day. When you get down to where you want to be, you can stop using the ASAP, and as long as you're taking the 90 essential nutrients appropriate for your body weight, you will not gain the weight back. That's the magic here, because weight gain, being overweight and being obese, is actually a nutritional deficiency, not lack of exercise and eating too much. So I believe we'll be able to solve all your problems. But make sure you're eating those 8 to 10 eggs a day, soft scrambled butter, soft poached, soft yolks, soft boiled, soft yolks, not fried, not over easy, not sunny side up. Call me every couple of weeks. I want to know your blood pressure. I want to know your weight and how the swelling is going in your ankles. Okay, Doug, we got time to start another one.
We can start one. Let's head to California. And Esther, you're on with Dr. Wallach.
Esther, you're on the air.
Yes, good afternoon, Dr. Wallach.
Hi, what's up?
It's good to hear you. I owed you a call from last year to to thank you for, you have been answered to prayer. I have the story of Olga, who got out of hospice thanks to the vitamins. It happened last year.
Okay, got out of hospice. That's a good thing.
Yeah. It's amazing. It wasn't supposed to happen, right?
Right.
But
well, it's amazing
year,
when the good Lord made us in His image, and God doesn't have diabetes. God doesn't have Alzheimer's disease. God doesn't have cancer. Yeah. And so, if we do the right things, we have the capacity to at least improve our quality of life and even reverse problems. Hang on, and we'll answer the rest of your questions after these messages. We're back with Dead Doctors Don't Lie, the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go right back to California and Esther. Esther?
Yes, hello.
Okay, how can I help you today, dear? Thank you so much for the great testimony.
Yeah, no, I just wanted to, again, thank you. What happened was last year, we gave some sample vitamins to our Hispanic pastor at church and his wife, Diana. They were looking kind of tired and all, and it turns out that Diana was taking care of a little old lady named Olga.
Okay.
And Olga had been depressed on account of the passing of her son, and she had stopped eating, and she was down to 74 pounds.
Oh, my.
So she ended up in the hospital finally, and the doctor put her in hospice. And she was given a deadline, like she was supposed to be dead on August 2nd of 2013.
Okay, so the doctor said in a couple of months she's going to be dead.
Right. But Diana, she was in hospice at home, and Diana was taking care of her. So, trying to figure out what to do with Olga, she shared a little of the vitamins with her. And Olga started to gain weight, and she gained 20 pounds. And next thing you know, the doctor kicked her out of hospice. And the doctor was saying, well, this never happens. It's not supposed to happen. But
well, thank you so much. God bless you for sharing that testimony, dear. God bless you.
Not at all. Thank you. And there's more. Because,
okay, just keep passing on the message. Yeah. Okay, Doug, do we have time to start another one?
Yes, let's head to Missouri. And Matt, you're on with Dr. Wallach.
Well, Matt, you're on the air.
Hey, Dr. Wallach. I am 35. I'm 5'9", I weigh 300 pounds. I'm taking the Healthy Start Pack, appropriate for body weight.
Okay.
I'm gluten-free. I eat none of the bad foods. I don't drink carbonated beverages. Obviously, I have significant weight to lose. I need to lose about 150 pounds. And when I do reduce my calories and take the ASAP, I lose about 2 pounds a day, exactly like you say. However, when I start losing weight like that, after about 3 to 4 days, I start having horrible gallbladder attacks.
Okay.
The cramps in your torso and all that.
Sure.
And I would love your advice because my wife wants me to have surgery, and I don't want to do that.
No. You don't want any surgery, especially since you're responding so well. So what I would do is make your liver happy. Okay, a 300-pound guy like yourself, I'd be taking 9 of our selenium a day. 9 selenium a day. That's in addition to the 3 Healthy Start Packs, right? 1 for each 100 pounds of body weight. 9 selenium a day, 3 for each 100 pounds. That'll be 3 bottles a month, 3 at breakfast, 3 at lunch, 3 at dinner. And then 9 of the de-stress capsules. Capsule D like David-Stress. 3 of those at breakfast, 3 at lunch, 3 at dinner. That's 3 bottles a month. That's going to give your liver all the additional stuff it needs to function and dealing with all this extra fat moving around, okay? When you're losing weight with the ASAP, it's going to be moving fat around. If you don't have these extra nutrients, the liver is not going to be happy, and it won't make enough bile to prevent gallstones and gallbladder attacks and all this kind of stuff. So we have to have the extra selenium and the extra nutrients to make the liver happy, and that's where the extra selenium and the de-stress capsules come in. And, of course, it's imperative to stay away from oil, salad dressings, cooking oils. If you eat canned fish, it's fine, but they got to be packed in water, mustard, tomato sauce, not oils. Stay away from things like margarines, mayonnaise, salad dressing. Stay away from egg salad sandwiches, ham salad sandwiches, tuna salad sandwiches, because they use a lot of mayonnaise and there are lots of oils. When you stay away from gluten, there's a lot of hidden gluten around, and so you might want to get a hold of that CD called Serial Killers to find out all the places. Even stuff like chicken rice soup has gluten in it. You say, well, where does gluten come from, or chicken rice soup, or chicken vegetable soup? That's because they use wheat flour for thickener. Same way with tomato soup. My favorite soup is cream of tomato soup. And then you eat out at a restaurant and say, what are they thickening this with? They come back and say, well, the chef says it's flour. Okay? But let us know how it's going. But, yeah, I'd throw in the extra selenium and de-stress capsules, and your liver will be happy, and all that cramping, your gallbladder will go away. Okay, thank you, everybody. Great testimonies today. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.